Hi, my name is Brandon Roth. I'm a nursing student at Miles City College. Today we're going to demonstrate a piggyback IV. We already have our IV set up from earlier, and now we are going to demonstrate the piggyback. The first thing we're going to do is we're going to look at our physician's orders and our MAR. We're going to compare patient, date of birth, the information on both. We're going to look at we are going to administer 560 milligrams of chloroform IV piggyback, and that's going to be put in a 50 milliliter 0.9 normal saline solution. We have figured our our drop factor is 10. We're doing 50 milliliters in 45 minutes, and that's going to be approximately 11, just over 11 drops per minute. I'm going to check the date, of course, July 18th of this year, so we are good on our 50 milliliter sodium solution. We've got our other supplies, we've got our meds and our dilutants and needles, and we also have our second line of tubing for our piggyback. I've gone ahead and I've made a medication tag that will be added to the back of the 50 milliliter bag. This talks about what drug it is, the time, the date, the flow rate, and the time that we started. So now to prepare, we are going to draw up our medication. I'm going to wipe down our 2 vials. And actually on this one, we are not going to need our second vial. That will be for our third demonstration. We're going to put in 560 milligrams. We're going to drop our air. We're going to put it into our solution. And now we're going to draw that up. All right, and now that we have that, we are going to have that ready for when we're ready. Now we're going to open up our secondary line, and we're going to bring that out. And we're going to unwind it. Going to close off the roller lock. I'm going to hang this up above. We will actually take our regular saline and we're going to place it lower, and we will have our other bag up here. We will have to demonstrate this because this will not hook on there. There we go. We'll try that and see if it doesn't fall off. We are now going to take off the cap of our spike and the cap of this, making sure that we do not touch the spike. We're going to get our spike in there. We are now going to take our medication. We are going to clean off the injection port. And we will inject our medication into the bag for our piggyback. We will now hang this. Oh, before I hang it, I will take the prepared medication bag, and we're going to hang this. One step that I did miss in the beginning that I would like to go back and correct is our patients, the 6 rights of administering medication. We're going to make sure after we confirm our MARs and our MARs and our physician's orders that we have the right patient, right dose, right time, right medication, right route, and we're gonna do the right documentation afterwards. The other thing I forgot to do was wash my hands, and I'm going to make sure that my hands are washed and, if necessary, put gloves on. So we will do that now. Since we're not touching the patient, it is not always necessary, but it is definitely an added precaution. Now we're going to take our third alcohol swab, and we are going to attach to our lure lock system on the main line our medication line. And take the top off without touching it, and we have sterilized there. We're going to make sure that it is on tight. We are going to undo this line because we have to set our rate using the main line. And this is the new rate, which we calculated out to be just under three drops every 15 minutes. And so we would do that. We would then come in, take another package with a sterile wipe. Once we have that calculated, we would clean off the port and make sure that we did not touch this port. And now we're going to re-secure that we have it set. We have we would have primed this already before we started, but now that we have that set, we are going to run this 50 milliliter solution into the main IV lane for 45 minutes. Once we are done, we are going to come back. We are all finished. I'm going to close this line down. We are now going to take and put our IV solution back up on top and take down our medication one. This patient requires that medication to be administered every 8 hours. We will start a new bag then. We now will recalculate our drop rate back to the normal saline solution, which we had originally, until it is time to start another medication. We are going to dispose of our sharps into a sharp box. We're going to clean up the rest of our mess. I will have labeled the medication so that we will be able to use it again if there's enough in the vial for the next piggyback. Then we are going to make our documentation that everything was done on the MAR so that, again, we could verify for the next time we have piggyback or other type of medication to perform through the IV. And that's it.